But I also wanted to pick up what you also said, Elaine, about, you talked about public transport, having to rely on favours from neighbours. And so it's almost, as the GP who's trying to coordinate this, you've got to think about all these things. Yeah. In a 10-minute consult.
But also being aware about those non-medical decision making that's going on in the background for that individual, and it is being very aware of that. So because as I say, people are maybe making decisions not maybe on what, as you say, what they need, what they might do because of the where they live and their circumstances, rather than on what they actually would want for themselves, sort of things. So, and how many favours they're going to have to ask for and things, because so many people who do not like to ask other people to do things for them.
I say to patients, actually, when they're saying, I don't want to bother people with it, I said, well, if they'd got it, would you mind if they asked you about it? And they say, well, of course not. I'd want them to ask me. And I say, well, maybe you should think about, just asking it, because a lot of people, if they can do something, don't mind helping, do they?
I mean, I find it's amazing if you actually speak to somebody with a relative in the room with them, and they go, "Don't be daft. Of course, we'll take."